Okay, this is a case of a Maine Coon cat, and as we know, cats love to climb. They don't afraid, to be on a really, high trees, or in this case, the cat was on a 5-story building. Whatever happened, I don't know the backstory, but basically the cat fell from the 5th floor. So you can imagine the injury, the trauma. Now they brought the cat to a local clinic. They did the initial diagnosis. The pelvis was fractured. This is the X-ray. So basically the problem with the fractured pelvis is that it was fractured badly. And the doctor said that, well, ideally we have to do the surgery to rebuild the fractured pelvis, meaning that they attach the metal pins, but they cannot do it. There were several complications from the fall. The heart wasn't working really well, and it just was badly broken. So the only option was to do nothing. But the cat couldn't urinate, it couldn't defecate, it wouldn't eat. So, for 4 days, really, the cat was in a really bad state. So at this time, the cat owner really was looking through the city, and they heard about university clinic where Dr. Uyana worked, brought the cat in. So they suggested, okay, let's try coMra therapy, and they started a 14-day coMra course. Again, the protocol, if you open the human user guide, was universal 3, the blood, and they did traumatology 5, plus scanning over the injured area. Now here the recovery was amazing. Well, first of all, 2 hours after the first treatment session, the cat stood up. Now that was amazing, just with the amount of injury. And remember that the coMra therapy has a really good analgesic effect. Now the pain relief after the treatment is really good. I mean, I fell on my ankle, broke it when I was climbing, so I know how it feels. The pain relief is so welcome when you apply coMra therapy. So on the first day, the cat already, showed signs of recovery. By day 4, the cat was able to fully urinate and defecate by itself. It was walking around the apartment. It had appetite. So clearly, the recovery was really well on its way. And I mean, it was really amazing what happened on day 7. This is the middle of the coMra course. It was started to jump on a sofa. It was jumping on a windowsill. Again, this is not something veterinary doctor was expecting. Not on a 7th day. On the best day, it would be, let's say, after a month of recovery, the cat would be, jumping again. So, what we've seen here is that even in such a complicated fracture, and on a right X-ray, they did another X-ray to confirm that the bones are healing really well. There is a nice buildup of bone tissue on those fractured areas.